All right, we'll get started here in just a moment. If you have team members that have not left for the airport and you want to corral them, now would be the time. Oh, I think you can go to the next slide. Do my slides up? Okay. There we go. That looks familiar. Is there anyone we're waiting on? I know this is a tricky day. So really quick update about what we'll be doing in this session. So I know I gave a preview. So we're building off of the value propositions that we just worked on. This time we're going to do, again, a lot of hands-on work, but we'll be working on building out a dissemination strategy. I know that there's inclement weather, and I think almost everywhere we're going, there's severe rain, there's tornado watches, and there's winter storm warnings. So can I see a show of hands of who is leaving before 2:30? Just so I want to, okay. So I know that one group is leaving at 2:15, correct? 2:15? Two, and okay, so I will come to your groups first, as we everyone will get attention, and I will still try to not talk too quickly, but I do encourage you all, because we will probably not, especially those leaving early, get through your entire dissemination strategic plan. But again, this is iterative process. We're just kind of building some of the foundational blocks. And then if you have team members that are not here or had to leave even earlier, there's some extra, at least a few extra value proposition and dissemination strategy worksheets in the back. I also put my business card out there too. So if you have questions as you start to work on this as well, happy to answer those questions. So this session is called Beyond the Manuscript, Disseminating for Sustainability. So next slide. So one of the things I really want us to think about as we talk about dissemination is the interconnectivity of dissemination and sustainability. So I know we talked about this a little bit, but I want to just kind of poll the group and see sort of what comes to mind when you think about how can dissemination help your sustainability efforts? All right, to the man from Tennessee, yes.
Yeah, if you don't share what you've done, no one's going to pay you to do more of it.
Great. So if you can't share what you've done, no one's going to pay you to do more of it. Okay. No one's going to replicate it. No one's going to publish it. No one's going to fund it. Yes. So the dissemination piece, as I said in our first session, is really integral. And as researchers, you're constantly having to validate the work that you do. This is just kind of putting that marketing lens to it. Next slide. So I'm not sure if you're familiar with the diffusion of innovations theory, but essentially at its core, it seeks to explain how, why, and to what extent and what rate new ideas and innovations spread. And so perhaps surprising or not, the greater the perceived advantage, the quicker the innovation will be adopted. So as you think about what you're disseminating and how you're explaining it, that value, that return on investment are going to be really paramount. Again, I know sometimes these will be broader statements. We talked about the fact that outcomes data is not available, but there's other ways that we can lean in and sort of speak to that value piece. And then influencers. So these could be influencers because they're payers. They could be influencers because they're in the governor's office. They could be influencers because they are very well connected in your state, or they have a lot of money that they could donate for philanthropic purposes or a plethora of other reasons. But of course, influencers, because they can get their message out to a broader group, are able to more quickly advance both the adoption of your dissemination messaging. So just something to keep in mind. So I don't want to belabor that too much, because really the meat and potatoes of this is going to be the worksheet. So if you go to the next slide, we're going to be passing out a worksheet. So my friends at Apt are going to be passing out this worksheet. You should have also received an electronic version. Today, if you want to work off the electronic version that you were sent, you can, or you can just use that, use a physical version that's being passed out along with your pencils. But the reason that you got an electronic version is so that, one, if you need more space as you continue to build this out over time, also if you want to share it with other colleagues, et cetera. And this is really, you know, what we're doing today is sort of the building block of getting this started. So once you have this sheet, I'll quickly go over it. So I'll just wait a moment. Okay, so I think everyone has this now. So what I've done with this worksheet is on the left-hand side, kind of given you some prompts of things that I want you to think about that are really important components of a dissemination strategy. And then across the top in blue, I've put together different audiences. This is not necessarily an exhaustive list, although I did want to list enough that seemed like it would be relevant given the work that you're doing. Some might be ones that you have not thought about before, and hopefully these can serve as prompts. There's also an other category as well. But as many of these audiences as possible, I want you to kind of think about, what do you want them to do with the information? What do you want them to know? How might you reach them? What's going to be persuasive? How will you track the dissemination efforts? And then, very importantly, who's going to lead the dissemination efforts and follow up? So, having a dissemination plan, but not tasking anybody with actually executing it and checking in on the follow through is just called a piece of paper. So again, and before you leave today, so even those that are leaving early, I'm going to ask you to name somebody who's going to be your champion for the dissemination plan and the person who's in charge of tracking. And that tracker, their first assignment is to see if that dissemination lead has helped finish the dissemination plan. Homework assignments. If you didn't know, my first foray was actually in academia as a professor, so I love homework. A couple of things I want to draw your attention to in this dissemination plan. So there's a lot of diversity of audiences, but also if you go to the next slide. I also have internal dissemination. So this is the piece that sometimes people are the most confused. Why would I need, Sarah, why would I need to internally disseminate? Well, not everyone in your institution is working in this specific project or as is sort of entrenched in it as you are. It's important that the directors, the presidents of your university, the heads, the people that hold the purse strings know what you're doing and why it's important. The groups that are doing synergistic work within your organizations or maybe bid on similar kind of funded research, well, maybe there's some cross synergy there for you all to work together, or at least share some lessons learned. But also that brain drain piece that I spoke to in the beginning is like, if you don't share the work that you're doing and effectively capture it in a way that other people within your organization can pick it up and keep running with it, then once that champion, if that champion leaves or retires or whatever it is, that information, those lessons learned, those 3 years of progress leave with them. And I've seen that in a lot of research projects, and probably the group that's most often overlooked is that internal dissemination piece. So I want you to think both internally, and then internally can also mean not just your specific university, but also your collaborative. Does everybody that you're working with that you really spent all these years fostering relationships know what you're doing? Are they on board when they talk to other people about their involvement in this project, sort of staying on that same message, or excited about the work that you're doing? Have you shared that value proposition with them? And are they keeping that in mind as they look at also collaborative funding opportunities or ways to publish together, all these different ways that you can work together? So there's the internal piece, and then of course the external piece, which again can be those peer-reviewed journal articles, can be the additional funders and so on and so forth. So you all can read, so I won't go through the whole list across the top, but it speaks to both that internal and external piece. And then again, just that reminder of leveraging like-minded influencers and organizations. So sometimes, it takes more than one group or one collaborative to sort of move the needle. And so again, don't overlook other groups that have a similar sort of value or are trying to also drive primary care in the state, and sort of see how you all can kind of work together. I want to encourage you to take out your value propositions from earlier, because again, that's going to be really helpful as you work through the sheet. And don't worry, I'm not going to make you work through the entire dissemination plan on your own. This time you can begin as teams. So why don't we go to the same tables that we were before? And if it's easier to work through the audiences that you've already started to think about, that's okay. But I do want you to get a little uncomfortable too and tackle at least a couple of these audiences that might be new for you to think through and start working through the questions. I'm going to give you about 15 minutes, and then we'll pause and kind of do a check-in, see how folks are doing. I don't think you'll get through the whole sheet, but I want to see if there's any common questions. We might have a couple more minutes after that. And then I have some discussion questions. And then later I'll ask each of the states to share not your entire sheet, but one or two different audiences, and kind of walk us through your thinking. And we can react and provide a little bit of feedback. Does that sound good? Okay, great. So again, I think Tennessee was in the back, Michigan was over here, and then we had Ohio and Alabama. Any questions about what we're doing? No? Okay, great. And then Julie and I will be walking around, eavesdropping, providing support. One point of clarification, academic can also include academic journals. And as you think about dissemination, please also be doing so with a sustainability lens. So these are, you're both trying to get your message out, but also groups, organizations, entities that might help with the sustainability piece. Okay, we have about 3 minutes. Okay, that's your little prompt to wrap up what you're writing. Okay, Michigan and Tennessee, let's get to a stopping place. No, I like the enthusiasm. And I want you to know I'm not expecting you to be done with the entire document right this second. If so, you can write a lot quicker than I intended. Okay, so I'm going to have to switch things up a little bit. Originally, we were going to dive into some discussion and questions and metrics and tracking. And for those that are able to stay until 2:30, you're still going to benefit from all of that discussion. But I also want to honor the fact that some people need to leave early. So we're going to front load the share out workshopping session. And I'm going to start with the Alabama folks since they're the first ones to leave for the airport. So we probably only have time for you to just share one audience, kind of pick that audience and walk us through where you landed in your worksheet, if you ran into any challenges as you were developing that, and then also what messages you're hoping to share with them, and then who's going to be your designated dissemination champion and tracker. Can you turn your mic on? Thank you.
Sorry, forgot about that. So for our audience, we chose the internal group, so our cooperative members.
I know you have the mic on. Can you still speak up a little bit?
Oh, yep. Can you hear me? Okay. So for our audience, we chose our internal cooperative members. Our desired action is continuation as a part of the cooperative beyond this project. In terms of messages that will persuade them is impact report about our current activities, so ranging from our practice facilitation activities to our virtual community of practice, because I think that's the main thing that everybody keeps reiterating that we need for them to make decisions. So I think that would be the most persuasive message. In terms of how we can reach them, I put webinar or listserv, both of which we already have currently. Tracking, we do have a tracking database already built for other activities, so we could just build out another app to track our dissemination activities with this group. And then who it would be assigned to, it would be me as the program manager, since I know all the things that's going on.
Okay, any questions, reactions? So if not, I'll just share one. So thank you for sharing that. I'll be brief. I promise. I know you have to go to the airport. One piece I would encourage you to do is, I know that webinars are great in terms of you see attendance, and you can get certain metrics that way. Listservs are great. You can see how many it's reached, how many it's opened, etc. But since these are internal partners, I would think, although correct me if I'm wrong, that you also have points of contact who you're in sort of communication relationship with. So I would also sort of encourage you to reach out to those individuals directly and give them that information, give them that nudge, and also include that as part of your tracking to say you spoke with so-and-so at XYZ. And also, are they going to, is part of that ask also that they share across internally as well? Because again, while external listservs are great, but sometimes people may or may not sort of pay them as close to mind as we would like. But usually if that's coming down from that key influencer, that director, that president, whomever that person is within the organization, that oftentimes can increase that open rate and help with that nudge. And that's one more piece of follow-up and tracking that you can do. And then afterwards, you're not one and done. So they've sent it out. Well, what's the feedback? Are they planning to actually, they got the impact report, they attended the webinar. Are they planning to do this, or they foresee challenges or other things that perhaps you should chat about? So again, those metrics are great, but that's just one step in that sort of tracking and follow-up piece. So thank you very much. Let's hear it for Alabama, and safe travels. Okay, so I think that brings us to Ohio.
All right. We were going across in rows, so I don't have one all the way done because we're like a third of the way done on all
We're
of them.
here to help workshop it with you too.
So I will just share that with you. We'll choose internal, which I guess, do you want us to choose a different group?
Yeah, why don't you choose a different group?
All right, new partners. We talked about regional extensions, AHEC, and some of the ag extensions as new partners. What we have a payment-based model for Medicaid with CSIP. I don't know what CSIP stands for, but it's a Medicaid value-based payment program, different than the regular Medicaid value-based program. And they're doing a lot of similar work that we want to leverage. So we wanted to reach out to them. And then employers, getting a little bit more engaged with employers. So we put desired action was to leverage resources for aligned activities, but also to have them implement learnings. I'm sorry,
can you speak up just a little bit?
Sure. One was leverage resources for aligned activities where those match, and then implement learnings or activities that we have that we want them to implement. And we thought messages that would help persuade them was around, improved outcomes, improved workforce well-being, and sort of us being able to help in that sort of a trusted convener way. And then we had, and return on investment, sorry, that was there too. And then method, how can you reach them? We really need to set up some conversations. Oh, but for the dissemination, yeah, I don't know that we know fully yet without meeting with them and exploring those new partnerships. And then we'll have to see what that looks like. And then, tracking, and we'll have to depend on what we do for dissemination with them. Then assigned, we have a dissemination engagement sustainability team. So somebody from that team will likely be assigned to that.
Okay, so I have some questions and feedback, but does anyone else want to jump in first? Okay, so for desired actions, I know you said that and again, these are works in progress. that you would want them, for them to take the quality improvement efforts that you'd want them to implement? Do you know what exactly you would want them to implement?
Yeah, we would probably have them do things that had been successful. So some of our hypertension or diabetes quality improvement project learnings that were successful for at least the employer space. But for CSIP, it's more around leveraging resources. They have a patient and family advisory committee, and we're talking about leveraging that to do statewide patient and family advisory committee. So it's different depending on the partner, and regional extensions, just to understand and see where we could collaborate around activities for improved health.
So it sounds like, again, there's an electronic version of this, so you may even want to add some rows there, or columns, I should say, because again, some of those messages, those sort of pain points and where they place value is going to be different across those different groups, and you want to make sure that it's being tailored as much as possible. For the tracking, the first thing that, the first step that you said is to get meetings in. So again, sometimes tracking can be really sophisticated. You're using social listening platforms. You have a lot of, access to in-depth online metrics. Sometimes tracking is, and I think of like a lot of the direct service providers. They're like, well, I picked up the phone and I spoke to the social worker and they did, and they told me they did what I asked them. Sometimes tracking doesn't have to be as new age as we think. So the first step is getting a meeting. So it's like, did you research who you have to contact? Did you reach out to them? Did you schedule the meeting? Did the meeting happen? What were the next steps for the meeting? What did that follow-up happen? So again, sometimes dissemination can be very elaborate, and sometimes it can be really sort of going back to basics. But there's always some kind of tracking piece that can be done. And then for the assign to, well, I think it's good that there be someone within your dissemination group, but I also want to acknowledge that person's not here, and so there is a role for one of you to at least follow up with that person, so they can be the tracker, but one of you here should be the dissemination lead, at least as it relates to the plan, because you sit the closest to it. Now, that dissemination person might be able to help tweak that and massage it and polish it off a little bit more and help do some of the additional groundwork. But I want to make sure that you see yourself in the worker bee part too.
Yeah, and we'll be the ones probably having, I mean, I would probably need to be in those conversations. It's not like, okay, somebody else is just going to talk about it. Yeah, thanks.
Great. Any other feedback for Ohio? All right, safe travels. Okay.
So don't think if you go next, you get to leave. Just want to make that clear.
All right. Any other time constraints I need to be aware of? No. You guys get extra brownie points for staying on time. Okay, so we will come here with Michigan.
All right, this is Anya from the Michigan team. So we did one column, so that's the one I'm going to do. We talked about professional organizations. So the audience that represents for us is reaching providers beyond the 50 clinics that we're working with in the heart health interventions. And we have a whole bunch of potential desired actions. I think they kind of fall into two buckets though. One is real like dissemination of findings and tools to providers. So like reaching them with the materials that we're putting on our website, the self-help versions of our tools, that kind of thing. But I think the second bucket is so being supportive of future funding opportunities. So either partnering with us, supporting future recruitment activities, or being like sort of a supporting organization or endorsing funding requests or funding advocacy, saying like, yes, providers actually want this, that yes, this is actually useful to providers. Messages that we think might persuade them is narrative around our program and like our practice facilitators being trusted advisors and neutral partners to practices, that the support they provide helps practices be more efficient and effective, that we really understand practice operations, we know what it's like on the ground, and that what we do in helping them with quality improvement, it also supports their success in other quality improvement programs or alternative payment models, and that the impacts that we have on efficiency and quality improvement can also And supporting team-based care can also have positive effects on provider and staff morale and satisfaction. And we also thought that provider testimonials might resonate with provider organizations also, like examples of satisfied or happy providers that we've worked with.
I actually just wrote that down.
Methods, we can do direct outreach to their like marketing and newsletter teams and that kind of thing. That's something we've done a lot in the past. We can also reach them at conferences or through providers that we're working with who are members of those organizations. Tracking, we actually have a dissemination work group that we launched late last year. I'm the chair of that work group. And we have some tools, including a tracker that we're using to track product development. So I think what we can probably do is expand that tracker to also include places to track like activities, like, you know, reaching out to a provider organization, getting into their newsletter, or, you know, other dissemination activities with them. And so assigned to, I'm the chair of the dissemination work group, so I would be leading it with support from the members of the work group.
Okay. And people say I talk fast. That was a lot of information. Thank you. Any questions, feedback from Michigan? Okay, Jay.
You probably thought of this already, but you know, you were talking about testimonials and reaching out through the professional organizations. But have you gotten invited or gotten yourself an invited position at like the family physician's annual meeting? Those tend to be more kind of clinically focused. But if you come in and have a testimonial about here's how I help my practice, you know, that kind of thing,
Not yet.
they're usually open to that.
Any other questions or comments from Michigan? Okay, I'm going to share just a couple. One, you have a lot of messages. So one of the things I would want you to think about as a potential next step for this document is actually working on crafting those messages. You'll probably need to add some extra rows to so that way each one has some space within the document. I think the fact that you have a tracker is great to just build off of what you already have, especially if people in your team are already going there, just making sure it's assigned to somebody. As you develop those messages, I would encourage you to take out that value proposition and take a look at it again and see if those messages reinforce that, or if perhaps those messages have added or sort of changed anything that you've already said in your value proposition. So again, I mentioned earlier today, kind of using that as a litmus test. I think the testimonials are great. I would also say, you know, thinking about the ROI piece, maybe even like some case studies, et cetera. You mentioned that you send out a lot of listservs and e-newsletters. Have you also talked to the providers to see, are they actually reading those e-newsletters and messages? Because sometimes there's the dissemination reach or potential reach, and then there's the actual reading and uptake. And if there's not, then it might be sort of signal an opportunity whether you have some of those better partnerships where when you're soliciting folks for testimonials to try to also encourage them as almost like brand ambassadors, where again, it gives you the opportunity to sort of share your value proposition and encourage them to also talk about the project, not necessarily in a super formal way, but they're going to have connections in a more kind of grassroots way with other primary care, either practices or organizations, or maybe they're going to these meetings, and you can say, well, you know, if you're not at that meeting, oh, well, you know, if you're going to XYZ conference and we're working on this, feel free, you're like, please encourage and tell people about this work that we're doing. So again, sometimes that word of mouth piece can also be an important component in sort of the broader dissemination strategy. So I just encourage you to kind of think about that. But I think you have a lot of ideas. So, and you sound really excited about the work. So I encourage you to keep using this and building out. I encourage you to try to build it out as much as possible and then share it out with your team. And again, you have electronic versions, so you can put it on a shared drive and you know, for version control and kind of keep working through it. So hopefully this is not the first and last time that you use this document. So great, let's hear it from Michigan. All right, Tennessee.
Okay, should I just, I was thinking about doing two.
Yeah, you can do two.
columns.
Yeah, absolutely.
Okay.
That's what we were originally going to do, but.
Okay, and these are really both not fully thought out, but internal. Internal, we really have to do a lot to communicate with internal audiences, especially the chancellor's office of our university, the UT president of the UT system, who we really haven't, have just begun to, get on his radar screen, and our deans for the colleges, across um, our 4 campuses of the state, who are represented in the executive council. But so both our executive council and our advisory council are sort of internal audiences. Desired actions. We want more recognition from the university. Specifically, we want some improved space. We have some of the worst space in the university. We're kind of down in the basement. Faculty positions, we want faculty positions. We want more marketing and communication support. And a little more IT support, actually, our IT department. And our messages that resonate are that UT is leading prevention and primary care extension, and there's a lot of excitement at UT around statewide reach, and UT making a difference statewide. So I think really orange messages work really well there. Our methods, we've been working on an annual report, a colorful annual report that anyone will be attracted to reading, and so that's, I think, our most important, what we're actually doing. But internally, in terms of our own team, we've been working on a one-sheet metrics focused resource newsletter document where we can have a monthly email to our team. Here's how we're making progress. How many people have signed up in our data network, because we've not been good about tracking our internal metrics as good as we'd like to be. So that really gets to the tracking piece. Of course, for most of the things in the internal audiences, we're going to know if we're in better space, right? So those are sort of high level, but yeah. And then who that's assigned to our Deputy Executive Director, Annie Ninen, I think is going to help us organize a lot of these efforts. But Nikki, our communications person, and our program coordinator, Nikki and Brandy, I'm thinking will be the main ones on the internal audience piece. And should I go ahead and turn to the...
No, let's pause there for a second before we go through the next one. So any questions or reactions? 10 minutes, okay. Wow. Any questions or reactions to what Tennessee has shared? I'm the only one with reactions. Okay. So I'm gonna be quick. I feel like we could chat all afternoon. So one, I want to make sure for the assignments that both of the people you listed are not here today. So I do want to make sure that there's someone from your team who's here that's going to be sort of helping champion alongside with them. You mentioned that you have a communications person, but also that you want greater recognition within the university. Have you had any meetings with the university-wide communications office?
That's a really good point. We've not really had, we've had little email, it's all been indirect.
I would encourage you to set up a meeting, because email, we're all guilty of we're inundated with emails. But I would encourage you, similar to when we talked earlier about kind of getting in front of those, state legislatures, that face-to-face piece where you're able to really sit down, like go through your value proposition, have a one-page leave behind. But the thing is, if you make people's jobs easier and you make things really easy, plug and play, like everyone loves that, especially busy communication folks. And I've worked in a university communications office, and their job is mostly to brag about the university and to also, support the development office in a way with, fundraising and to support the recruitment office in recruiting. And all of the work that you're doing is elevating the research, the research capabilities of UT, the relationships that UT has, the fundraising, like everything that that you've explained really aligns with what would be of interest to a communications officer. And if you already have some of this sort of pre-packaged in a way that's very promotional and very ROI centric, then it seems like something that would be very well served, whether it's the website, whether it's the newsletter that goes out to all UT folks, whether it's a press release. Oftentimes you can't, I can't speak on behalf of ARC because again, I'm the new girl in the room, but most of my experience in federal space is the federal communications offices will not send out press releases, but if your communications office wants to send out a press release from UT Communications about the great work that you're doing, usually that's okay. And so, there's a lot of avenues yes, I see a thumbs up, yay. So there's a lot of avenues for you to tap into, and that's exciting because they don't have to go searching for the story. You brought the story to them. So just like you would pitch a journalist, you can pitch them too. And even if journalists too, if they're doing a lot of stories around issues with primary care and whatever else, well, why not, reach out to them and make that pitch, or connect with your comms person and jointly make that pitch. So I think you have a lot to sell here. And I'll let you, I don't think we're going to have time to go through your second piece, if that's okay. I want to quickly go through the other items because, well, you guys stayed the whole time and somehow we're still running out of. So dissemination planning. No, we already went. Oh, no, we haven't gone through this slide. Dissemination. Yes, we did. Okay, can you go to the next slide? Yes, go to next slide. Okay, discussion. So one of the things I just really quickly want, we don't have a time to actually answer these questions, but just one thing I want you to make note of is how many of the audiences on the sheet were perhaps new for you. I didn't want to be too prescriptive, but I also wanted to kind of nudge you to think about some other audiences, whether that is, a legislative office, whether that's thinking about new partners that are not part of your collaborative, whether it's thinking about internal audiences. Also, thinking about not just sort of the standard ways to reach people, but I'm sure that there might be different meetings or other places that you go that you might come in contact with some of these folks. So really using every opportunity that you might come in contact with someone to kind of use that as an opportunity to sort of sell your story and your project, and also leaning in on that both value proposition and that sustainability piece. And then as you work through more of this document, hopefully after you get home and in the coming weeks, you can go back and kind of look at your value proposition and say, does my value proposition work for all of these audiences, or do I need to make some additional tweaks? Next slide. We haven't had much time to talk about dissemination tracking. Again, I do want you to try to crosswalk ways that you can track the work that you're doing and assigning that to somebody across all of the different audiences. Again, there's ways that you can, whether it's you're looking at I know like Google Analytics is kind of like the main piece, but that's just sort of tracking people at large. But really taking opportunities when you meet with your collaborative partners, asking them, did you see that newsletter? Like, what did you, like taking every opportunity to solicit impact or input and kind of feeding that into your tracking sheet. Also, like just picking up the phone or contacting somebody and asking them to leverage their networks. In HIV testing, we have social networks testing. So if it's like, we have one positive case, well, maybe they're more likely, and you think of this sort of cluster effect. Well, the same thing's true with all of our information networks. I'm connected to different people than you're connected with, but we're all here. And if we all go out and start communicating with our networks, it's like the ripple effect, that sort of diffusion theory that I was mentioning earlier. Suddenly that information gets out, a lot quicker. And if you're all staying on message, that also helps that information, trend more rapidly. I feel like I'm going so fast, I apologize. And then the next slide. So I think another important piece too is that like, what do you want to track? So some elements might be more salient based on your position within the university, things you're required to track for the grant, but then also other things might be more important to track because of sustainability. How many of your partners are committed to continuing to do the QI work within their individual practices? And if you don't know the answer to that, have you asked them? So really getting at the heart of what are you required to do at your university, what are you required to do for your grant? And then what do you really need to know as it relates to sustainability, and using those to also help guide some of your tracking. There's a lot of different platforms. Your communications office might also be able to help. For example, like my company uses Meltwater. It's a social listening and social media platform. And so a lot of universities probably use that, and it costs them absolutely nothing to run an extra report of social listening for key words and metrics related to your intervention, and you can automate a report. So literally once they type it in, it's kind of one and done. And so there's a lot of things that can be really easy to track. And then you can see who's sharing information, what are they talking about as it relates to our organization. Oh, I didn't realize we got picked up there. So there's a lot of different things we can do. And then setting goals for yourself, not of when you want to finish this document, but also for your dissemination project as well. And I already mentioned the champion piece, and then I think there's my contact information at the end. And then my business cards are in the back if you need to reach me. So we have one or 2 minutes left to spare. So any questions? I apologize. That was a little more rapid fire than I think we envisioned, but thank you for working hard today. I know it was a lot of hands-on activities. Okay, well, thank you for spending your day with me.